I'm Dr. Felipe Matsunaga, and I'm a Senior Interventional Radiology resident, and I'll be speaking to you today about percutaneous nephrostomy placement. To answer that, we first need to understand how the kidneys work. As many of you may know, healthy kidneys filter and clear waste products from the blood by producing urine. This urine then travels from the kidneys through paired tube-like structures called ureters into the bladder, where it's stored until the patient urinates. Sometimes urine can't flow to the bladder because of an injury to the ureter, causing leakage into the belly, or more commonly, a blockage somewhere along the urinary tract, possibly from a kidney stone or mass. If the blockage is left untreated, the urine may build up and lead to increased back pressure and swelling of the kidney and potentially damage it. In addition, this blocked urine may also become infected, possibly leading to a life-threatening condition called sepsis. Percutaneous catheters are plastic tubes inserted through the skin and the flank, which connect to the kidney and help drain the urine and relieve the back pressure. The procedure takes about 30 to 60 minutes on average. The patient lies flat on their stomach on the procedure table, and the entry site for the nephrostomy catheter in the flank or back is cleaned with antiseptic solution, numbed with an anesthetic such as lidocaine, and draped with a sterile sheet. Additional sedative and anesthetic medications are given through an IV line to minimize pain and discomfort. Following this, a small skin incision is made so that a thin needle and wire can enter the kidney. Ultrasound and/or fluoroscopy, which is a form of X-ray imaging, is used to guide and confirm successful entry into the kidney. The needle and wire are then replaced with a nephrostomy catheter, which is secured in place to the skin with stitches and/or an adhesive sticker. The nephrostomy catheter is then attached to a drainage bag, which relieves the pressure and collects the urine. This bag is small enough to be easily hidden under clothing and should not be noticeable. Percutaneous nephrostomy is a very safe procedure, though complications and risks do exist, as with any medical procedure. A little bit of soreness along the catheter entry site is to be expected, but should go away after a couple of days. Bleeding requiring further treatment, such as transfusions, is an important risk since the kidney receives a lot of blood supply. In order to decrease this risk, the patient should not take anticoagulants or blood thinners before the procedure for a set number of days, which are determined by the interventional radiologist performing the procedure. That being said, a little pink-colored urine collecting in the drainage bag that starts to clear over the next couple of days is to be expected. The nephrostomy catheter may also malfunction and stop draining. This may happen if it becomes dislodged or clogged with incrustations or little stones from the urine. If this is the case, then the catheter needs to be replaced. However, a couple of things can be done to prevent clogging, such as maintaining a good amount of oral hydration and flushing the catheter with around 10 milliliters of sterile water every day. A nephrostomy is usually temporary and removed when the blockage has resolved or been treated, though this may potentially take many months. However, sometimes these blockages cannot be treated and a nephrostomy needs to stay in place permanently. When the nephrostomy catheters remain in place for a long time, they need to be replaced about every 2 to 3 months to prevent clogging. This exchange procedure is similar to the initial nephrostomy placement, but quicker, taking on average up to 30 minutes or less.